Hi everyone, you're listening to the Health and Wellbeing Podcast. I'm Alison Mitchell, a practicing naturopath, and you can find me on naturopathnsw.com.au. Today, I'm going to be talking about nutrients that we need for our thyroid health. In particular, I'm talking about the role of iron in our thyroid. These podcasts will feature discussions on various health conditions, health tips, and nutrition from a naturopathic perspective. Sometimes it's just me, sometimes I'm interviewing guests. All the time I hope to share with you information on health and wellbeing with the aim to empower and educate. Please remember that all information is general and not a specific recommendation that replaces consulting with a practitioner. Please talk to your healthcare practitioner before undertaking any changes to your treatment regime. Hi everyone, today I'm going to be talking about the nutrients that our thyroid needs for healthy functioning. Now I'm going to assume that you already know that our thyroid has a lot of beneficial roles in our body. It's really important for our overall health, and if you haven't already listened to it, I suggest that you have a look at my previous thyroid podcast that I did with fellow naturopath Lisa, and today I'm going to be talking about the building blocks. So the first thing that we really need in order to have a healthy functioning thyroid and for healthy thyroid hormones is cholesterol. Cholesterol is a core fatty acid, and we actually need it for the manufacture of hormones. Now, a lot of people know that too much cholesterol can be problematic, but the thing is that too low cholesterol can be problematic as well. And the reason for that is because we actually need it for a lot of functions in our hormonal health. And then from there, what we do is we start to add on vitamins and minerals and other enzymes and things like that come into play as well. And that's where the building blocks of the thyroid come together. So the thyroid hormone that we most commonly know is TSH, and that's actually a pituitary hormone. So TSH is made in the pituitary, and the main thing that the pituitary needs to make this is manganese. Manganese is a mineral, and we actually only require it in really, really small amounts, so we call it a micronutrient. And because of this, we don't want to be going crazy with supplementing. I would suggest that if you're concerned about your manganese levels, then you would talk to a practitioner about this. Because it's a trace mineral, the dose is usually very, very small. So the pituitary manufactures TSH, which then triggers the thyroid to make your T4 hormone. And so in order to have this happening, your brain needs protein, magnesium, vitamin B12, and zinc in order to make the TSH. The thyroid makes 90% of your T4, and only 10% of our T3 is actually made in the thyroid. So the thyroid requires the amino acid tyrosine, the mineral iodine, and also our cholesterol in order to make your T4. It's tyrosine in the middle with 4 iodine molecules hanging off of it, and these are bonded with minerals, especially zinc. In order for our periphery, which is everywhere else that's not actually in the thyroid, to convert T4 to T3, then we actually require the minerals zinc and selenium. So one of the main areas that this actually happens is in our liver, and this occurs during our phase 2 liver metabolism. If phase 2 liver detoxification and metabolism isn't working properly, then this conversion isn't going to work as well. So one of the issues that can occur to actually affect this is if we have really high levels of circulating insulin. Insulin is a hormone made by our pancreas in response to having a high sugar diet or a high refined carbohydrate diet, and it's very important. However, when we have too much of it, our liver can actually struggle, and what also happens is we get more thyroid binding, so the thyroid hormone is going to be bound up rather than being available to be used by our cells. So the other thing that will actually affect our thyroid function is stress. Stress can inhibit our T4 to T3 conversion, and so if we're very stressed, this is going to be affecting us in a lot of ways, and thyroid function, unfortunately, is one area that we tend to suffer in. So even if you're taking medication such as thyroxine, it's really important that you get enough of the nutrients that you need to have a healthy thyroid. So thyroxine is actually a synthetic version of our T4 hormone, and it's not going to work properly if you're deficient in the nutrients that you require to actually have this T4 to T3 conversion. So for instance, if you're deficient in zinc or if you're deficient in selenium, then you won't be able to convert it to T3, which is where it's actually active in the body. So I'll go into a bit more detail about those nutrients that we need. So tyrosine is an amino acid, and it's a major one that we require for our thyroid hormone manufacture. And it's actually the base of the thyroid hormone itself. Selenium is a mineral that's essential for thyroid hormone conversion. Selenium also has the benefit of being protective against heavy metals such as lead and mercury, both of which are harmful to the thyroid. Vitamin D is essential for thyroid health, as well as its pituitary recognition of thyrotropin releasing hormone. It's essential in our T3 binding process, and it also helps to guide the T3 into the cells where it can be used so that it's made available for other cells in the body. So what sort of dose you need of vitamin D actually depends on what your blood levels are to start with, but you want to aim to keep your blood levels of vitamin D at around 100 to 120 if there's actually a thyroid issue. Those are Australian reference ranges, by the way. So to get to that amount, you can't rely on sunlight as your major source unless you're already there, but supplementation is going to be important in that case. Now, it's up to you in terms of how you want to do that, whether you want to do it through a tablet or you want to do it through a liquid form, or for instance, you might want to do it in a food form that comes as a supplement such as cod liver oil. So what I would normally do or recommend is start with a larger dose and then monitor your blood levels, and then once you've found that it's getting up to a high amount that you're happy with, then you can start dropping down the dose. Vitamin D, now you probably know that this is important for your bone health, but it is thought that the way that it is involved in our bone health is actually via a hormonal action, and in particular via our thyroid. So vitamin D is also essential in the immune system, and deficiency of vitamin D is also related to autoimmune problems. And this is important as there is strong autoimmune involvement in a lot of thyroid problems such as Hashimoto's or Graves' disease. We also need vitamin E, and that helps us to convert T4 to T3. Now, copper is another essential nutrient, but it is often high in a lot of people, and this can be problematic because it can displace zinc, another nutrient that we need a lot of for a healthy thyroid. Copper toxicity is often related to estrogen dominance, which can also partially suppress thyroid function. Now, iodine. Iodine is one of our most critical minerals for our thyroid health. We need around 150 to 200 micrograms per day for general health, but more is often needed when we're looking at trying to treat a deficiency state. Iodine belongs to a group of elements called the halides, and so too much exposure to these other halides can be problematic in keeping our iodine levels in good ranges. Iron deficiency used to actually be our number one source of thyroid problems. However, now we know that thyroid problems are more so related to autoimmune conditions. However, in some places, iodine deficiency is still rampant. Iron is an essential nutrient that helps us to carry the oxygen around in our red blood cells, and one of the most common symptoms experienced with iron deficiency or anemia is fatigue. And funnily enough, it's also a common symptom of hypothyroidism, alongside heart palpitations and hair loss and shortness of breath, difficulty concentrating and low mood. Iron deficiency is found in up to 60% of patients with hypothyroidism, and a correlation has been found between low levels of iron and hypothyroidism in women. So it's important to consider, if you do have hypothyroidism, what your iron levels are. Unfortunately, iron deficiency is often missed in people with low thyroid function, probably because the strong correlation of symptoms, and so it's often not really thought to look further. Being deficient in iron can cause thyroid problems, and being hypothyroidism or having other thyroid problems can cause iron deficiency as well. So you can see it's a bit of a vicious circle. We need iron for our other thyroid nutrients to work properly in the body, and so this is our iodine, our selenium, our zinc and our tyrosine. Several studies have found that supplementing with iodine alongside iron actually provides a greater effect on thyroid health than just supplementing with iodine alone, particularly in those who are already deficient in iron. So there's a few areas where iron's involved in keeping our thyroid happy. if you're deficient in iron, the thyroid hormone can't get properly transported into the cells where it can do its thing. And so this will still show as having a normal T3 level in the blood, but you'll still be experiencing symptoms of having hypothyroidism. One of the main enzymes you need to synthesize the thyroid hormone is thyroid peroxidase, and this is actually heme dependent, which means that it requires iron to work. So if you're iron deficient, then this enzyme is going to be reduced in its activity by 30 to 50%, and this can really slow down the conversion of your T4 to T3. Also, iron deficiency can disrupt adrenal health, which is another area that when it's out of balance, it can cause some thyroid problems. So that's how iron problems can affect your thyroid, but how can thyroid affect your iron? Well, in women with hypothyroidism, your periods are more likely to be heavier, and this is commonly a cause of low iron levels because they're losing a lot of blood. Also, thyroid hormones can affect your gastric acid secretion, and so one of the areas that this is going to be affecting us is in our absorption of nutrients. Iron in particular needs good stomach acids in order to be absorbed. So if your thyroid's causing your stomach to not be working properly, you're not going to get enough iron. It's also not uncommon for people with thyroid problems to have food intolerances, in particular to wheat. And if you're having issues with foods in terms of intolerances, then your digestive system is more likely to be inflamed, which can again affect your absorption of nutrients. Second to blood loss from heavy periods, one of the ways that your thyroid can be affecting your iron levels is via inflammation. It's not uncommon for people with thyroid problems to be inflamed and or overweight, especially in those with hypothyroidism. And this can affect how much iron you're actually able to absorb. And the main reason why this is affected is via a hormone called hepcidin. This hormone increases when you're stressed, when you're inflamed, when you have an infection, and it can also be increased as a result of certain medications, and it will also be more likely to be increased when you're overweight. So it's quite normal for our body to lock away and prevent the storage of iron when we do have an inflammation such as an infection. It's a protective mechanism. But when we have inflammation going on for too long a period, or chronic inflammation, then this can really cause havoc with a lot of other balance in the body. So knowing how important these nutrients are for our thyroid, how can we get plenty of them? Well, we want to be eating a balanced diet, which means that we're not having too much of one thing at one time, and we're eating a big variety of foods. So the more variety you have, the more nutrients you're likely to get. And one of the ways that we can get in iodine in particular is with seaweed and seafoods. Seaweed is not everyone's cup of tea, I know, but it can actually be quite palatable, particularly when you're having it in the form of like crunchy baked seaweed, like seaweed snacks or seaweed chips. That can be really good. But if you're still not a fan of that and you don't really like sushi, then what you can do is you can get some seaweed and use it in your cooking. So you can put it in soups, you can put it in stews, you can use it in the cooking water when you're cooking your rice or your beans and other legumes, and it will actually help to break down the protein. What it will also do is it will impart some minerals into the cooking water. Not a huge amount, but a little bit is always beneficial. And so then you can take that seaweed and you can chop it up really finely and distribute it throughout the food. And a lot of the time you won't really notice the flavour. Other foods that are really rich in iodine include eggs, spinach, garlic, watercress, pineapple, and certain citrus fruits. Foods that are rich in zinc is seafood, especially oysters. Oysters are probably the most zinc-dense food that's out there. Beef, oatmeal, chicken, liver, spinach, nuts and seeds, and ginger are also good sources of zinc. You can get plenty of selenium in Brazil nuts, but unfortunately Brazil nuts do vary a lot in their selenium content. It is often thought that those that come or are sourced from Brazil tend to be much higher in selenium, whereas those that are grown in Australia and New Zealand don't seem to have as much, probably because we don't have much selenium to begin with in our soil. Thanks for listening, and if you want to keep up to date with my podcast, then please subscribe on iTunes. Otherwise, you can find me on naturopathnsw.com.au. See you later.